Type 2 diabetes used to be a health condition considered only for adults. And now that's changing because we're finding it in our children at alarming rates. Back in 2000, of the children diagnosed with diabetes, only 3% were diagnosed with type 2. 10 years later, 3% is now 50%.
20 years ago, when I came into the field of diabetes, we didn't see type 2 in youth. And now it's exploding. In fact, when you look at the number of kids diagnosed with diabetes today, half of them are diagnosed with type 2 diabetes.
The number one risk factor for type 2 diabetes in children is obesity. And today in the US, 1 in 3 children are either overweight or obese. According to the Center for Disease Control, of the children born in the year 2000, 1 in 3 will develop type 2 diabetes in their lifetime. The good news is that type 2 diabetes in children is preventable. This will take an effort of epic proportions, and we believe it's time that healthy food steps forward, and families in the blueberry industry are coming together to lead the way. The Blueberry Family Health Foundation is a nonprofit started in late 2013 by blueberry families with the vision to end type 2 diabetes in children. We're doing an inventory of the resources the foundation can bring to the table with the diabetes community, from access to healthy foods, logistics, expertise, relationships. The Blueberry Family Health Foundation is going to create a unique bridge between agriculture and the diabetes community. Think outside the box and get to the heart of the issues holistically. For example, what if we could get healthy snacks into the hands of kids who can't afford them or don't have access, who really need them, to 10,000 hands, 50,000, 1 million across the country? Our next year is built on 3 major pillars. The first is research. This research is critical because any program or project that we engage in has to be based on sound assumptions and sound metrics. The second is building the right team. This means bringing together the world experts from agriculture and diabetes to develop our philanthropic strategic plan. And the third is infrastructure. To accomplish big things, you need serious infrastructure. Under the direction of our executive director, Kari Rosenfeld, we're also taking the next months to put in place the staff, software, financials, accounting, auditing systems that are necessary to pull this off.
The Blueberry Family Health Foundation is so unique because I've never seen an industry come together under one cause, the way the blueberry industry, the growers especially, have come together to fund the Blueberry Family Health Foundation and to do outreach to people with diabetes, especially children and families who are cursed with type 2 diabetes.
We are in our startup phase, and the key is to do this right, ultimately, so we can be bold and make a difference, and that's why we need your help. First, get involved. If you're interested in learning more, developing a relationship, or if you or your organization want to brainstorm how we together can tackle this vision of ending type 2 in children, contact our executive director, Kari Rosenfeld. Second, we're looking for your financial support today. It will take serious resources to meet our 2015 goal to launch our first pilot programs for children.
In my conversation with those in the industry, we all agree this isn't about selling more berries. This is about doing the right thing for children. Our crop is an emblem for health. Let's use it to help those who need it most.
We invite you to become a part of the Blueberry Family Health Foundation. Join the family. Together, we can end type 2 diabetes in children.